Hi, I'm Katie, Elemental Health's AI guide. In this video, we review the research on ketamine to help guide your decision-making process. Ketamine is one of the most researched and exciting developments in modern mental health treatment because it challenges many of the assumptions we've had about how depression and trauma are treated. For decades, most psychiatric medications worked on serotonin and often took 4 to 6 weeks to begin helping patients feel better. Ketamine changed that conversation by demonstrating something remarkable. Meaningful symptom relief can happen within hours or days instead of weeks. One of the most compelling findings in ketamine research is its rapid effect on suicidal thoughts. Multiple clinical trials and recent meta-analyses have shown that intravenous ketamine can significantly reduce suicidal ideation within hours after treatment. In some studies, patients experiencing suicidal crises showed dramatic reductions in suicidal thinking after just one infusion. What's especially important is that these effects can occur even before a person feels fully less depressed. Researchers now believe ketamine may work through pathways independent from traditional antidepressants, directly interrupting the brain circuits involved in hopelessness, rumination, and suicidal thinking. Another compelling area of research involves neuroplasticity, the brain's ability to adapt, reorganize, and form new neural connections. Depression, PTSD, and chronic stress are associated with rigid, repetitive patterns in the brain. Ketamine appears to temporarily increase the brain's flexibility, creating what many researchers call a window of neuroplasticity. During this time, the brain becomes more capable of forming healthier emotional and cognitive patterns. This is one reason ketamine is often paired with therapy, mindfulness practices, journaling, lifestyle changes, and emotional processing. The medicine may help open the door neurologically, while therapeutic work helps patients walk through it in a lasting way. Researchers are also studying how ketamine affects large-scale brain networks involved in depression and trauma. Brain imaging studies have shown that ketamine can rapidly change communication between regions involved in emotional regulation, self-referential thinking, and the brain's default mode network, which is often overactive in depression and anxiety. Many patients describe depression as feeling mentally stuck, trapped in repetitive thought loops, emotional numbness, or chronic hopelessness. Ketamine appears to temporarily interrupt those rigid patterns, allowing the brain to reset and become more adaptable. Another major reason ketamine research has gained so much attention is its effectiveness in treatment-resistant depression. Roughly 1/3 of patients with major depression do not respond adequately to traditional antidepressants. Ketamine has shown significant benefit even in patients who have failed multiple medications and other interventions. Research also suggests ketamine may help improve symptoms beyond depression alone, including anxiety, PTSD, chronic pain, emotional numbness, and anhedonia, which is the inability to feel pleasure or connection. Importantly, the research continues evolving. Scientists are actively studying different forms of ketamine, including IV ketamine, intranasal Spravato, oral formulations, and newer compounds like S-ketamine, and ketamine metabolites that may eventually provide similar benefits with fewer side effects. At the same time, researchers are also emphasizing the importance of safety, medical supervision, careful screening, and ongoing therapeutic support. Ketamine is not a miracle cure, and it is not appropriate for everyone. But for many patients, especially those struggling with severe treatment-resistant symptoms, it has opened new possibilities for healing, where few previously existed. Perhaps the most hopeful part of the research is this: ketamine has fundamentally shifted the field of psychiatry toward believing that rapid healing and meaningful recovery are possible. For many patients, it represents not just symptom relief, but the return of hope, flexibility, connection, and the ability to imagine a future again. We are happy to go over treatment options and answer questions during our consultation process. We can be reached at 208-801-1414. Elemental Health. We are here to help.